Welcome to the next step of this module number 1. This is the step number 2. Search for and collect the most relevant best evidence. To understand what external scientific evidence is and how to access to it, first you need to know that the external evidence is information from research studies, especially studies conducted within the framework of patient-centered clinical research, the purpose of which is to generalize and use the results in different clinical settings. There are different formats and media, like scientific articles published in journals, reports, theses, that are used to disseminate the content of these research studies. So you must learn to read this type of documents. At the same time, it's very important to know what are the most important digital databases that collect published research papers and summaries of evidence, and how to search for information on them. Finally, it's important to know that in recent years, AI tools are being developed and can help us in the research for external evidence. Some of these tools will provide a summary of the research and determines whether there is a scientific consensus on a topic. So, to know a little more about how to search for external evidence, on this video we will briefly answer 3 important questions. What type of external evidence exists? How to start the search? Where to search for external evidence? Learning how to do quality searches requires a more extensive course and above all practice. So here in this video I will show you some important ideas regarding this topic. First, you must know that there are 2 types of external evidence. External evidence, according to the level of processing or treatment of the evidence, is classified into primary or original studies, like documents showing original research in which researchers report and discuss the results of individual research studies. These studies usually have the following objectives: to analyze the best diagnosis test, to decide on the most effective treatment, to know the prognosis of a disease, to study the risk factors and causes of 13 clinical and health conditions, and to understand how a health condition affects the subject's personal experience. So you will find different types of studies like randomized controlled trial, cohort studies, case control studies, etc. Primary studies communicate and present novel knowledge from research and are usually published in scientific journals. Thousands of primary or original studies are published each year. In the second side of the slide, you can see the other type of external evidence that we call pre-appraised sources. These documents are syntheses of knowledge that systematically search for and combine results from all relevant or topic-related original studies, and this will provide you with a more complete and reliable answer to your clinical question. Nurses need to quickly find answers to clinical questions. Therefore, searching for evidence that has already been appraised for the quality of the study methodology and the reliability of its findings is desirable. By using pre-appraisal literature, nurses can cut down on the amount of time they spend in determining whether they have reliable information, which reduces the time between finding suitable evidence and providing best care. In the next slides, I will show you the most important documents that show us pre-appraised literature or sources. The first one is the summary of evidence. All of these documents integrate the best available evidence from clinical practice guidelines, systematic reviews, and primary studies to provide evidence-based information on the best management options for a particular health condition. What makes this category very interesting is that the information is presented as a summary of recommendations to answer a clinical question after a critical evaluation of the best evidence. The second one of the pre-appraisal sources are clinical practice guidelines. I'm sure you have heard about these documents anytime. These are documents that provide information to manage and provide the best care for a specific disease or health problem. They are usually extensive documents, as they respond to many aspects of care for a given health problem and clinical situation. The important feature of clinical practice guidelines is that they synthesize and evaluate research findings, presenting a specific recommendation for clinical decision-making and optimization of patient care. The third one of the pre-appraisal sources are the systematic reviews. These are documents that integrate data from multiple research studies, primary studies, on a topic. The analysis focuses on a specific aspect of a given health problem and intervention by addressing a few well-defined clinical questions. Systematic reviews can present the result in a narrative form as a descriptive presentation of the data from the included studies, or perform a statistical analysis showing a global indicator of the result of the quantitative studies included in the systematic review. In this case, they are called meta-analysis. The second important question that we must know is how to start the search. Many resources and tools exist today to help streamline the process of finding relevant external evidence quickly and efficiently. Haynes and Alper proposed the pyramid model for practical guidance in selecting resources to quickly find the best evidence. In 2016, the latest model proposed by these authors appeared. You can see in the slide the 5S pyramid model for finding evidence. Starting at the higher level of the pyramid, just here in the systems, you will save your time because the resources within these levels have already identified and critically evaluate the most relevant research on a particular topic. As the authors of this model point out, each of these levels should systematically build on the lower levels and provide substantially more useful information to guide clinical decision-making. Therefore, your search should follow the direction of the pyramid, starting from the top and moving toward the bottom, from here to here. The third question is where to search for external evidence. As I told you before, you should start your search at the top of the pyramid. However, the systems are still under development. This will allow our patients' point of care to have immediate access to the most up-to-date documentation from research, but this is still some way off. So we must start here in the second level, summaries of evidence. And here we find different type of databases like up-to-date, Dynamed, EBM guidelines. In the third level, we must search for clinical practice guidelines. And in the fourth level, systematic reviews. In Cochrane Library, for example, on primary studies is in the bottom of the pyramid, and we must use and search for in PubMed, Embase, and WAS. I will show you some of these databases. In the second level, as I told you, the summaries of evidence, you can use a very important database that is called UpToDate. It's a clinical decision support resource widely used by healthcare professionals. It is an evidence-based peer-reviewed database designed to provide clinicians with concise, reliable, and up-to-date information to help them make informed decisions at the point of care. Present search results in a clear and user-friendly format designed for quick reference, especially during clinical decision making. The downside is that the subscription is required, although hospital or organization often cover the cost through institutional access. In the third level, we must search for clinical practice guidelines. And the National Institute for Health and Care Excellence, NICE, is a UK organization that provides evidence-based clinical practice guidelines. It is funded by the Department of Health and Social Care, and its resources are free to users. As of January 2025, NICE has published over 200 clinical guidelines covering a wide range of medical conditions and procedures. In the fourth level of the pyramid, we must search for systematic reviews. And the most important database is the Cochrane Library. This one is a renowned resource that provides access to high-quality systematic reviews on healthcare interventions. It synthesizes the best available evidence to inform clinical decision-making and policy development. As of January 2025, the Cochrane Library contains 9,352 Cochrane reviews. And in the last level of the pyramid in the bottom, to search for original studies, you must search for in different databases like PubMed, Scopus, Web of Science, Signal. These databases allow users to search for original articles and also systematic reviews across a wide range of disciplines, mainly healthcare disciplines. PubMed is a freely accessible, while WAS, Signal, and Base require subscriptions to access their full content. These resources are vital for researchers seeking high-quality peer-reviewed studies to inform evidence-based practice. So it's very important to know how to search for information on these databases. And finally, as I mentioned previously, you must pay attention to the new AI tools. In the last year, this type of tools, like I showed you in the slide, are very important and have been developed in the last years. So this type of databases can help us to find in a very easy way the different research about the topic that we search for. But this is in the development, so it's important. It's going to be very important in the future, and we must keep an eye on it. Finally, learning how to search for in the bibliographic databases is really important. Nurses need to acquire some skills and follow the searching process step by step. In this slide, I show you all these steps. The first one is to determine the search terms that we are going to use. So we must identify the key words from our PICO question and select the merged terms. Those are the terms that are used in the databases. And the second step is to search in the appropriate databases. As I showed you in this video, there are many of them, and depending on the type of source that we are searching, we are going to use one or other of these databases. Also remember that we have the opportunity to use in the future AI tools. The third step is construct an appropriate search strategy. There are search and connectors like Boolean connectors that we can use in this strategy, and we must know how to use them. And the last one of this process, the last step, is select the evidence to read. So we must select the documents that respond to our PICO question to find the response. Thank you for being here in this video, and see you on the next step.